Hi there, my name's Anne.
My name's Liz.
And my name's Stuart.
And we are pharmacists working with the Crisis Healthcare Service. We're just going to talk a little bit about our medicines policy and prescribing in the Crisis Service. Crisis stocks a limited formulary of medicines that's designed to meet the needs of the guests that we see during the Christmas period. We review this list every year according to the conditions that we've treated the year before. When your team goes out to run a clinic, you'll take a box with you that's got all the medicines in that you ought to need for that clinic, and you can give those straight out to guests. The legal status of our service is that of a dispensing doctor service. So what that means is that even if there's a pharmacist present, ultimate legal responsibility for all dispensing lies with the doctor who wrote the prescription. If there's a pharmacist present, he or she will almost certainly actually dispense the medicines for you. If there isn't a pharmacist present, then medicines should be selected and dispensed by 2 registered members of staff, one of whom should be independently checking the work of the other one. All the medicines we send out with you will have instructions for use already on them. If it's an over-the-counter product, that will just be the package instructions, the way you would buy it. If it's a prescription-only medicine, then we'll have over-labelled it with some information. That will ask you to fill in the guest's name, the date, and also maybe the number of tablets or capsules that you want them to fill in. You need to complete that information before the medicines are given to the guest, and a second person should check that that information is accurate. Additionally, we'd also ask you to keep a list of things that you've given out. We'll give you a stock list for that purpose, because that just speeds up the process of refilling the boxes at the end of the clinic.
So in most cases, we've chosen pack sizes of medicines that we can give complete packs to the guests. So we don't have to worry about splitting packs up and keeping track of stock and that sort of thing. There are a couple of exceptions to that. One is Lemsip sachets and throat pastils. So we just ask the volunteers to select the appropriate number that they think might be suitable for the guests, usually 2 or 3 days. We go back to centres every other day, so if the guest needs more supply, we can make that when we go back to visit the centre the next time. The formulary that we have has been selected based on the needs of the guests that we've kind of worked out over the years. We don't allow any FP10 or private prescription prescribing, so you can only use the medicines which are on the formulary. If the formulary doesn't have what you normally would prescribe in your practice, then you can speak to either your team leader or one of the pharmacists in your team and see whether there might be an alternative that you can use. We usually only have certain analgesics for use in the service. So we usually only have paracetamol and ibuprofen. We don't stock benzodiazepines or offer any withdrawal therapies, but we do have very close links with drug and alcohol services at the centres. So if there is any particular guest that you might be worried about, you can refer them into those other services. And we can also provide onward referral onto NHS services at a later point as well.
Because of our legal status as a dispensing doctor, we're not allowed to allow non-medical prescribing at Crisis. However, pharmacists may provide non-prescription products in response to symptoms as they would in their normal practice, but we do ask that these are recorded like a prescription in the notes. We also ask that you maintain the same high standard of prescribing at Crisis as you would in your day job. For example, checking for allergies and interactions with other medications. We also expect our prescribers to think as they normally would when prescribing antibiotics. Antimicrobial stewardship is everyone's responsibility. Prescriptions should be clearly written in the dedicated space on the guest's medical record. Guests often come to see us for repeat prescription requests, which we're obviously not able to fulfil. They may have run out or misplaced their medications, and quite often the easiest thing to do is to get them to where they last left their medicines. While we can't provide a repeat prescription, we can usually offer transport for them to obtain them. Sometimes we can just reassure guests that missing a few doses won't be a problem and it's not going to have any significant effect on their health. Other times, if the medicine is important, we can normally get them into NHS services where they can obtain a prescription or an emergency supply.
So that's it really. Thank you so much for volunteering with Crisis. We really hope you enjoy your time working with us. If you've got any questions, please talk to your team leaders or talk to the pharmacists on your team. And that's it. Look forward to seeing you at Christmas. Thank
See you at Christmas.
Bye.